This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. Hi, I'm Mark Alyn, and along with the insane Daryl Wayne, we're going to spend the next 2 hours talking about a wide variety of health issues, ranging from innovative new products and technology to how to get what you want out of life. We'll be spending some time with Robert Clancy, the author of Soul Ciphers, today. We'll spend some time with a woman who teaches you to break free, and we'll end up in about 2 hours from now with Jennifer Stapp as we talk about new developments in naturopathic medicine. All that and much more. In fact, right now we're going to talk about breast cancer. As the ending of October happens, we're going to once again talk about Breast Cancer Awareness Month, and I can't think of a better way to raise awareness to let everyone know about the latest and best way for radiologists to detect breast cancer. We're going to spend some time with Kevin Harris. He's the CEO of a company called CureMetrix. They're using the latest technology, including artificial intelligence, for more accurate breast cancer detection. Kevin, welcome to Late Night Health.
Pleasure to be here, Mark. Thanks.
Let's talk about what women should do generally, even before they go to a doctor. Is your background in healthcare itself, or is it in technology?
No, I'm not a doctor, and I don't actually come from a deep background in healthcare. We've built this company, CureMetrix, around technology and just general good business.
Gotcha. So I guess we should start by saying that women should, on a regular basis, do self-exams. I mean, we've talked about this in the past, but would you say that's the first step to discover if indeed a woman has breast cancer?
Well, self-exams are definitely important, but they're part of an overall broader screening program. Breast cancer is a very serious disease and affects many women in this country and globally. So starting with a self-exam, but certainly making sure that you see a doctor regularly and have a mammogram as scheduled is very, very important.
Yeah, some of the insurance companies have raised the age range. It used to be 40, that 40 and up, women would get breast mammography. And some of the insurance companies are now making it 50, which is, in my way of thinking, ridiculous.
Well, this is a debate that goes on globally, and it tends to swing back and forth depending on where the public attitude is. In some countries, it's younger. In some countries, it's older. And as I think you're alluding to, a lot of it is driven by cost. But there's also part of it driven by what actually happens physiologically and whether or not the doctors believe that catching it earlier makes a difference. So I think for the most part, everybody believes that the sooner you can catch breast cancer, the better the outcome for the patient. So I think that the push will always try and be from the patient's perspective to have screenings happen earlier.
And at the same time, over the last 2 years, we've been interviewing women who've had breast cancer in their late 20s and even early 30s.
Well, that's definitely going to happen. And unfortunately, when it happens in younger women, it can tend to be more serious. And that's one of the things that we're trying to put in place with our software here at CureMetrix, and that's what we're testing, is our ability to try and find breast cancer earlier. Because the earlier you can detect it, the higher survivability rate as well as the lower cost to treat.
And the sooner somebody can start treatment.
Absolutely.
Right? Men also get breast cancer. We don't talk about that enough. Should men be doing exams as well?
So definitely, I think it's worth checking. Only about 1% to 2% of men actually do get breast cancer, so it is a challenge. But again, I think that as part of just a general screening program, if a man is concerned, that's something he should talk to his doctor about.
Gotcha. All right, let's talk about your technology versus what's on the market today. We want to find breast cancer sooner. We've talked about a number of different technologies, including medical thermal imaging. Can you give us a comparison between medical thermal imaging, which often is not covered by insurance, versus mammography, in your opinion?
Well, there's lots of different tools on the market that are used for screening. Thermography is one option that people have chosen. Typically, they pay for that out of their own pockets. But mammograms are the de facto standard, and not just here in this country, but internationally. In the United States, there's approximately 40 million mammograms a year that happen. So it is still the primary source of screening for breast cancer. Once you have your mammogram, however, depending on what the doctor finds, they may recommend you to an ultrasound or an MR or some other type of diagnostic procedure to clarify what they're seeing.
Mammography does have some radiation to it, and some women are concerned about that.
Yeah, a mammogram is an X-ray, so it does have some radiation associated with it, and I could understand how that might raise concerns to some. But I think that through the FDA and their testing and the U.S. Preventative Task Force and their standards, what they've set in terms of how often you should have a mammogram throughout your lifetime, I'm assuming they've evaluated the impact of that radiation on the life.
And do you happen to know offhand what the recommended time frame for mammography is? Every 2 years, every 3 years, every 5 years?
Yeah, so you should go in every 2 years. That's typically what women tend to do. And that's also, by the way, one of the reasons and things that we focused on in our software. If a doctor is looking at your mammogram this year and they miss the breast cancer, unfortunately, it might be a couple of years before you're back for another screening. So the focus of what we've really tried to put in place is to help doctors see what they might otherwise be missing. From our perspective, that's called sensitivity. And so we really try and help improve the sensitivity of the doctors to help them find more breast cancers.
And we're not talking about an extra X-ray or mammography or an MRI or a CAT scan or anything like that. This is a new way of reading the mammogram. Am I correct?
That's correct. The woman still goes in and has the mammogram as she would today. We take the mammogram as input, and our software, our platform, takes the image and processes the image and then returns to the doctor a marked up view of the image that kind of circles the what we call the regions of interest. And those are the areas that the doctor should pay attention to. Those are the anomalies that might be suspicious.
Women who have dense breast tissue are more at risk of not having breast cancer discovered. CureMetrix can help improve the percentage of discovering beginning breast cancer earlier. Can you comment on that?
Yeah, so women with dense breasts, it is definitely a challenge for the radiologist. Mammography in general is one of the hardest disciplines in all of radiology. And for a woman with dense breasts, it makes it that much harder for the radiologist to see what might be buried in there. So as part of our investigational device, we have been testing on a whole slew of patients. We've actually processed hundreds of thousands of images. And among those are some of the most dense. And we have focused our efforts on trying to make this software actually work well, really well, on dense breasts. Our goal was to put in the hands of the doctor a tool that they could use on an average Tuesday at 2 p.m., regardless of which woman walked through the front door. We wanted to make something that was very powerful and really was a clinical aid to the doctors.
And this is not another X-ray. This is a reading of that X-ray, a new way of reading it, correct?
Correct. We don't interact with the patient at all. There's no new radiation. There's no new procedure. In fact, there's no new hardware at the hospital. We grab the image and process it in the cloud, and within a couple of minutes return to the doctor our report.
Wow. That is that I always find working with the cloud fascinating, and I know that X-rays and MRIs are now instantaneous, where you used to have they had to be developed and looked at, and now by the time you get dressed, your results are available.
In fact, that's part of our product. Because the way that the CureMetrix software works is quantitative in nature, we score those anomalies. And based on that scoring, the studies that we've been conducting, we're able to help the doctors prioritize their work list so that the most serious patients can be seen maybe even before they've left the waiting room. And that's one of the goals that we've been working towards, is really trying to optimize the efficiency in the clinic as well as the efficacy of the doctor.
Our guest is Kevin Harris. He's the CEO of CureMetrix, based in the San Diego area. We're going to take some time out. When we come back, I want to talk about algorithms, something I absolutely do not understand. They talk about algorithms on Facebook, on Google, so maybe Kevin can shed some light for us on what an algorithm is and how it works, and how we can improve the efficacy of mammography. I'm Mark Alyn. This is Late Night Health. Join us at latenighthealth.com, also at facebook.com/Late Night Health Radio. More coming up.
You're listening to Late Night Health with Mark Alyn. The show continues in a moment.
Welcome to Guide to the Soul. This is Robert Clancy. If love had a time, a place, and a limit, it would be right now, everywhere, and forever. Your heart is an infinite ocean that holds that divine love. Be in gratitude for every moment of your life that you've experienced, even the smallest moments of love. For when you add up all the love within your soul, you become priceless. Share your wealth with the world. You can leave a monument on your grave as your life's legacy, or you can live a monumental life and leave your legacy of love.
For more inspiration from Robert Clancy, visit guidetothesoul.com or go to the Moments with Robert page on latenighthealth.com.
The experts at Web.com want to build your business a successful website for free, just like we did for these current Web.com customers.
We've looked at other website designers. There's nobody better than Web.com.
Web.com can build your website in as little as 7 days free. Plus, we'll promote it on all the major search engines. If after 30 days you're happy, we'll continue to provide promotion, hosting, support, and maintenance, all for one low monthly fee. If not, cancel and pay nothing.
If you're in business and you don't have a web presence, you won't be taken seriously.
Call right now and you'll also get a free .com or .net domain name for your new website, powered by VeriSign, the world's leading domain name provider.
No upfront charge for site build, after which ongoing fees apply. Rights to site are relinquished when canceled. Domain included during active service, after which fees apply.
800-489-8751. 800-489-8751. 800-489-8751. That's 800-489-8751.